Hello everyone, I welcome you all to this channel and to this 20th episode of Target Nursing Officer Exams video. Question number 1. Streptococcal throat infection can lead to option A. Malaria, option B. Tuberculosis, option C. Rheumatic fever, option D. SLE. Correct option here is option C, that is rheumatic fever. Rheumatic fever is a late inflammatory non-suppurative complication of pharyngitis that is caused by group A hemolytic streptococci or streptococci. Question number 2. All are Jones criteria for rheumatic fever except option A. carditis, option B. polyarthritis, option C. erythema marginatum, option D. chest pain. The diagnosis of rheumatic fever requires two major or one major and two minor manifestation and evidence of group A streptococcal infection. And what are this major and minor manifestation or criteria? The major diagnostic criteria are: one is carditis, polyarthritis, chorea, erythema marginatum, subcutaneous nodules. And the minor criteria are fever, arthralgia, previous history of rheumatic fever or rheumatic heart disease, elevated ESR or CRP, and prolonged PR interval. So we see here option A, it falls under major category, major criteria. Option B under major criteria. Option C under major criteria, whereas chest pain does not fall under major, either on major or minor. So the correct option here is option D, that is chest pain. All are the criteria for Jones criteria for rheumatic fever except chest pain. Question number 3. Treatment of choice for ventricular fibrillation. Option A, adrenaline 1 mg IV stat. Option B, antiarrhythmic drugs. Option C, carotid massage. Option D, defibrillation with 360 joules. The correct option is option D, that is defibrillation with 360 joules is the treatment of choice for ventricular fibrillation. Question number 4. Normal cardiac output is option A 4 to 5 liters per minute, option B 3 to 4 liters per minute, option C 5 to 6 liters per minute, option D 2 to 3 liters per minute. Cardiac output is the amount of blood the heart pumps through circulatory system in a minute, or also can be defined as cardiac output is the product of heart rate and stroke volume and is measured in terms of liters per minute. The average stroke volume for 70 kg male, average stroke volume is 70 ml, and the normal heart rate range from 60 to 100 beats per minute. So if we take the heart rate to be 72, the cardiac output will be equal to 72 beats per minute multiplied by 70 ml. This is per minute. So if we multiply this, we will get 5040 ml per minute. So if we convert this, we will get to 5 liters per minute. So we see here the cardiac output depends on the heart rate of an individual, and this is the range, the normal cardiac output range from 5 to 6 liters. So the correct option here is option C. 5 to 6 liter is the normal range of cardiac output during rest, whereas during activity or in case of athletes, the cardiac output may be raised due to increase in heart rate. Question number 5. The duration of one cardiac cycle is option A 1 second, option B 3 seconds, option C 6 seconds, option D 0.8 seconds. The cardiac cycle is the cycle that involves the complete contraction and relaxation of atria and ventricles, and this complete cycle is counted as one cardiac cycle, and the duration is approximately 0.8 seconds. This one cardiac cycles involve of 4 stages. That is, first is the atrial systole or atrial contraction, then the ventricular systole, then the atrial diastole, and the ventricular diastole. So this complete cycle is called one cardiac cycle, and it takes around 0.8 seconds. So the correct option here is option D. Question number 6. Which valve prevents the backflow of blood into the left atrium? Option A, aortic valve. Option B, pulmonary valve. Option C, tricuspid valve. Option D, mitral valve. The correct option here is option D, that is mitral valve, also called as bicuspid valve. Question number 7. Postural hypotension. Option A, drops in systolic BP less than 10 mm of mercury when a patient changes position from lying to sitting. Option B, drops in systolic BP of more than 10 mm of mercury when patient changes position from lying to sitting. Option C, drops in diastolic BP of less than 10 mm mercury when patient changes position from lying sitting. Option D, drops in diastolic BP more than 10 mm of mercury when patient changes position from lying to sitting. The correct option here is option B, that is, the patient will have postural hypertension when the systolic BP drops more than 10 mm of mercury when patient changes position from lying to sitting. The postural hypertension is a drop of blood pressure due to change in body posture, like the change of body posture to more vertical position, like from sitting to standing, or lying to sitting, or lying to standing. So the correct option here is option B, that is, the person will have postural hypotension if the systolic BP drops more than 10 mm of mercury. Question number 8. Inability to carry out normal activities despite intact motor function is option A, anhedonia, option B, apraxia, option C, apathy, option D, amnesia. Correct option here is option B, that is apraxia. Apraxia is the inability to carry out normal activities despite intact motor functions. Anhedonia is the inability to experience pleasures in any activities. Apathy is the lack of emotional feelings. Amnesia is the pathological impairment of memory. Question number 9. Which of the following condition is an early symptoms of myasthenia gravis? Option A, dysphagia. Option B, fatigue improving in the evening. Option C, ptosis. Option D, respiratory distress. This question came in the exams of RML conducted by AIMS in 2016. And the correct option here is option C, that is ptosis. Ptosis is the condition in which the upper eyelids drop. Question number 10. Which of the following is associated with increased intraocular pressure? Option A, cataract. Option B, conjunctivitis. Option C, retinitis. Option D, glaucoma. Correct option here is option D, that is glaucoma. Glaucoma is the chronic progressive eye disease that damage the optic nerve due to increase intraocular pressure, and this leads to loss of vision or blindness.